Hi Bhavan, I am Dr. Abinaya Alagarasan, consultant physician. Today we are going to talk about the trending disease, influenza. Influenza mainly affects the respiratory system. It's a viral illness. In the past, 1918, influenza was first identified. Later, there was pandemic in 1950, 1970. But in 2000, it has become like a seasonal disease. Every year you get influenza. If you are in a tropic or a subtropic region, it's almost around the year. In the past, we have got flu from birds, which was called as the avian flu, from pigs, which was called as a swine flu. Why we get this every year? Because the gene inside the virus keeps changing itself according to the human immunity. Even though you get a vaccine, it comes and affects you. But the severity of the illness, if you get a vaccine, is less. Commonly seen influenza is influenza A and B. There are many subtypes, but H1N1, H3N2 are commonly seen in human beings. What are the symptoms? Who are all affected? Mainly children less than 5 years, elderly more than 65 years, and people who are immunocompromised, like having cancers, who are undergoing treatment for cancers, like chemotherapy, radiotherapy, pregnant women, people who have chronic lung conditions, heart conditions, and kidney conditions are the people more affected by influenza. What are the symptoms of influenza? You can have sore throat, nasal congestion, dry cough, body aches, fever. These are some symptoms which you have in all the flus. But sometimes in an immunocompromised individual, this can complicate to lungs. Once you are infected with influenza, normally the duration is 5 to 10 days. You start shedding the virus in the first 24 hours itself. Peak of shedding of virus can be 24 to 48 hours. In immunocompromised individual, the duration of illness is even more. If you already have a heart failure or heart condition, it can worsen. Sometimes you might have myocarditis. Sometimes there can be encephalitis, which affects the brain. Any viral illness, you should be well hydrated. And symptomatic treatment for body pain, and you can take paracetamol. Please avoid NSAIDs because initially you might not know what kind of a fever. If you're having dengue, then it might get complicated. And antivirals, if it started within 48 hours, it shows better benefits. And if there is a secondary bacterial infection, according to the cultures, you might be treated with specific antibiotics.